Yeah, not unless you're going to be designing their set.
No, that's not how it's gonna be.
How is it going to be?
I'm gonna get a scholarship first for basketball, and then my second career is architect.
All right.
That's how it's gonna be.
Okay.
100% guaranteed.
That's 100%.
If you get drafted,
Tell me your full name. Tell me your name. I'm going to look for you.
give me the south side. Nasir, right.
Nasir, right?
Right.
Is it Bright?
Bryant.
Bryant. Okay, Bryant. Bryant. Nasir Bryant.
Nasir.
Kobe, ready?
Basketball.
Kobe got rings. He ain't got none yet.
So, I'm going to call you up. And I'm going to tell you when that one day you were sitting in your YOACAP office.
I'm probably gonna forget.
And see, you can't forget. If I'm not, you don't want me to forget your name, right? So you can't forget.
YOACAP.
YOACAP, I'm sorry. The YOACAP. All right, the YOACAP.
Emergency medical technician. The people that make the ambulance.
Now, you get to see a lot of blood. A lot of blood in the streets. Yeah, a lot of blood in the streets.
Is an emergency medical technician. I thought she said something else.
I'm sorry.
I thought she said something else.
Oh no, EMT, emergency medical technician. What about you, sir? I'm sorry. A vet? You said vet? Veterinarian? Nice. So that's all. That's medical. That's med school. Nice.
How many years you have to go to be a vet?
Ooh, it's like med school. Actually, I'm sorry. 4? You researched it? Okay. So then you go to med school, but it's med school on animals, and that's for 4 years. And then, just like med school, you come out, you might have to do a residency,
What does that mean?
where you work with whatever your field is that you want to work with. If you want to work with large animals or equestrians or smaller animals or dogs, you work with underneath a vet to get more specialized training, and that might be another 2 years, even after you finish like your medical school for the veterinary school. Nice. I have X-ray technician, as well as you have a ultrasound technician, as well as you'll have like a CAT scan technician and an MRI technician. Those are different areas of testing that we can send the patients for, and you need a technician who specializes with that machine in order to get the proper test or picture that the physician has ordered for that particular patient. And then you have, go down, ultrasound technicians, radiology. You have your secretaries. You can have your nursing clerical assistants is what they call them. And they're the ones that a lot of times answer the phone, make sure they know where the patient's going, who's calling, who's coming. They actually, to me, they kind of like run a certain level or amount of supplies that they think that you want to use within your daily routine of going to work for your patients for that day. You go to the OR, you have the OR technician.
What's the OR?
OR is the operating room. And we have technicians as well as nurses, as well as nurse anesthetists, as well as anesthesiologists. The nurse anesthetist and the anesthesiologist are the people who sedate you or put you under. It's probably the term that you might have heard when you go into the operating room so that you won't feel the pain of whatever procedure it is that you have. And then I think CPD, central processing, and some hospitals even have the laundry team, people who do just the laundry. And then they have the people who clean the rooms, that's your environmental service. And then, there's another group that I had in my brain, from all of those groups. So there is a plethora or a lot of, or a group, a lot of different jobs that you can hold down within the hospital.
So what's the difference between an RN and an LPN?
An RN is a registered nurse. A LPN is a licensed practical nurse. LPN can give out meds, but she only can give out pills. An RN can give out medications. They can give out IV medications. They can give pills. They can give shots. It's more than the IV administration of medication. IV meaning intravenous through your IV, through your veins. Okay. Schooling, I think schooling for an LPN is probably about 2 years. For schooling for an RN is 4 years.
LPN be more than
An RN makes more than an LPN. But an LPN make more than a nursing assistant. Most LPNs and most at this stage of the game, you don't find too many LPNs unless they've been LPNs for years. You have more in a hospital. You have more LPNs that work in nursing homes or other care facilities, the prisons. Versus in a hospital, you have your RNs and then your techs, your technicians, or your nursing assistants. Doctors specialize, just like a nurse can specialize. So doctors, you can have your orthopedic, those are bone doctors. You can have your pulmonary doctors deal with the lungs. You can have your neurologists deal with the brain. You can have your cardiologists deal with the heart. You can have your general medicine doctors, they deal with everything. So you can have your nephrologists.